Persons with disabilities, who according to the 2011 World Report make up 15% of the world's population, are a minority group and are often consciously or unconsciously excluded from mainstream life in many societies. With the outbreak of the coronavirus, disability stakeholders and persons with disabilities are advocating for the inclusion of persons with disabilities as stakeholders take preventive measures to curb its spread.
People with disabilities are part of communities, they are part of families, they are part of society, and so efforts to prevent the spread of the virus are more of a human right for everyone to be part of it, and on the basis of that, it's important for stakeholders who are involved in this response to very intentionally involve every person with a disability, adults, children.
Yeah, my plea with all of them is that they should see how they can consider persons with disability in every preventive measures that they are taking. They should not be left out because they also are part of the society.
We've embarked on aggressive advocacy with mainstream organization to raise awareness on the plight of persons with disabilities.
Persons with disabilities want to stay safe and are respecting prescribed preventive measures. Some of them have gone further to participate in facilitating preventive measures for persons with disabilities as well as their communities.
We understand that we are not to sit together, but sit 1 meter from each other. Secondly, we should cough or blow our nostrils into a flexible to prevent COVID-19. We understand we are not supposed to go to overcrowded places like markets, church, or sport gatherings.
I've educated my neighbors on the importance of preventing COVID-19. At first, we used to greet each other by handshake, or we embrace, or even children coming to embrace me on my way back from work, or even taking my bag to my house. With that, I've educated them that all of that with the prevention of COVID-19, they're not more important. So we all have to work towards the prevention of COVID-19. So with that, they really understand. I limit visitation to neighbors' houses, and I've also instructed them on the importance of staying in your own house. You can only communicate in the phone or you communicate at distance.
By regularly washing my hands with running water, sanitizing the hands when I don't have easy access to water, and respecting social distance. Then, as an organization of persons with disabilities, we have first of all sent out a press release that sets some specific guidelines for our brothers and sisters with disabilities to respect, and moreover to work with other stakeholders to see that we provide the preventive materials like the face masks, the hand sanitizers.
However, because their impairment limits their functionality, persons with disabilities risk being affected more by the virus.
So one of the challenges I face is the challenge of touching places, not knowing where is affected or how I can prevent myself from those things. That's one of the greatest challenges. And then secondly, some of the measures to prevent myself from it, some of the tools needed are somehow challenging to get in touch with them. Such as example, the hand sanitizer, they are very difficult to access them.
There are no interpreters. Many hospitals doctors, and nurses do not have interpreters for deaf persons.
The situation is made more difficult by the fact that stakeholders involved in the fight to prevent the spread of the virus in designing and implementing their activities often do not think about the needs of persons with disabilities.
Most of the time, persons with disabilities are forgotten in mainstream campaigns.
In some of the public services area where they have positioned, like for example, hand wash tools, I went to one of the places where they render services to the public. I was unable to access where the water for washing of hands is positioned.
So government's effort run by the Ministry of Health is geared towards prevention, and prevention would mean people are supposed to have access to messages, are supposed to be well informed about what is going on, what the virus is all about, how it can be gotten, how it can be passed on. But those details that make up public health promotion and prevention messages are often not accessible. And because they're not accessible, it implies people with different forms of impairments are not participating. They're not receiving the messages, and the moment you're not aware of what is happening, your risk of being infected is significantly increased.
There is need for all stakeholders involved in curbing the spread of the virus to think about and include persons with disabilities at all levels and stages of their activities and remove all barriers that prevent persons with disabilities from benefiting from the safety measures at an equal basis with others.
My advice to the government is that the government should provide material support to persons with disabilities. Secondly, they should work with us by coming to our meetings to encourage us on how to prevent ourselves.
Every action that we intend to carry, let mainstream campaigns, let 15% of the resources or the activities be specifically targeted to meet the needs of persons with disabilities.
An effective takeoff is it's important for us to have leaders of associations of people with disabilities, both men and women, are involved intentionally in consultative discussions to plan an effective response. So once that first step is taken, what follows is the specific needs of people with disabilities should have been expressed and adequately explained by their leaders, and so the chances are high that they will be taken into consideration. Secondly, in designing messages that are intended to sensitize and educate the wider public on how to prevent the COVID-19 virus, all those involved in conceptions and design of messages and broadcasts as well should recognize there are people with diverse information needs and take those needs into account. So our messages on COVID-19 prevention can always be produced and produced first in accessible format. That would mean, for example, having versions in Braille, in sign language, in print, in audio versions as well. But also the dissemination of these messages should be done in collaboration with disabled people organization. The third step would be to ensure that measures that are put in place to improve infection prevention, such as setting up of hand washing spots in communities, health facilities, and other avenues, we should know those are meant for everyone in that community.